Hello, everyone. You're welcome back to our YouTube channel, where we dive into the most important issues that affect our mind, our body, and well being. Today, we'll be looking at one of the most interesting topics as far as mental health is of concern that is affecting millions of lives across the globe, including Ghana as well. Have there been a time where you feel so never rested that you've never had a time to sleep for quality and even in quantity? Have there been a time that you feel so stressed up that it has affected your sleep cycle? Have there been a time that you find it so difficult going back to bed or falling asleep? In this episode, we are talking about insomnia. Insomnia. And joining me today in this section is a clinical psychologist, a lecturer at the Department of Education and Psychology, University of Cape Coast, in the person of Dr. Daniel Miezah. Doc, you're welcome to this episode.
Thank you for having me.
Wow.
Thank you for having me, Humphrey.
Yeah. So, Doc, today we are looking at one of the most sensitive topics as far as clinical mental health is of concern. And
Right.
there are a lot of people out there across the globe
Right.
that are fighting what we call insomnia. There are many a times that people claim they find it very difficult to sleep.
Right.
And even people claim when they sleep, they have short breaks within their sleep. So even in the middle of the night, they wake up and then they never go back
Right.
to bed again. You can see that this insomnia as a clinical mental health issue is affecting many lives, of course, especially even the youths, the aged, the adult. But then there are people out there that really doesn't know what insomnia is all about. There are a number of people going through, but they don't know that this is a mental health condition. So, Doc, from you, I want you to explain to us what insomnia is, or what actually is insomnia. When you talk about insomnia, what is it from your own perspective?
Well, thank you so much. So, insomnia, like you noted, affects many people. Almost everyone, once upon a time, goes through insomnia. So, insomnia, we are talking about a sleep disorder, right? And in this sleep disorder, people have difficulty falling asleep. They also have difficulty staying asleep.
Okay.
So, one, for some people, even the idea of trying to fall asleep is a problem.
Okay.
Not that they can never do it, but they have difficulties. They struggle before they can sleep. And if they do sleep at all, they have difficulty remaining or staying asleep. So they sleep for 30 minutes, 1 hour, they wake up again.
Wow.
So when you start seeing this kind of symptoms, we are talking about insomnia. Of course, it has to be manifested for quite a long time before we claim that the person is really going through something that is substantial enough to say that they are going through insomnia, right?
Okay.
So difficulty falling asleep and difficulty staying asleep, we are talking about a sleep disorder called insomnia.
Okay, wow. So, Doc, if an individual is finding it very difficult falling asleep or staying asleep,
Right.
usually at times where, insomnia affecting everybody, everybody, is there any cause to such problem?
Is there a cause
Is there
for insomnia?
Yes, is there a cause for
There are
insomnia?
so many causes of insomnia, of course. Just like any other condition has a cause, insomnia has a cause too. So one of the causes of insomnia is this. When people have body pains or back pain, it will definitely prevent them from being able to sleep and also staying asleep. Another big thing for insomnia could be that people are struggling with depression, people are struggling with anxiety, people are struggling with stress. If you take them one after the other, depression, when someone has lost a loved one, when someone has been sacked from their job, when someone has failed a test, when someone has been diagnosed with a medical condition where they've been told a terminal illness or a chronic condition, you are going to die, you're not going to survive this disease. All these things can lead to depression. And when people are depressed in this way, depression impacts on the brain. And let's not forget that it is the brain that regulates our sleep.
Okay.
It is the brain that allows us to be able to sleep, that regulates sleep.
Yeah.
So when depression impacts on the brain, they cannot sleep.
Okay.
For people especially diagnosed with terminal illness, you are going to have to buy medications for life. You are going to have to be on medications for or your lifetime.
Okay.
And this will definitely set depression in. It impacts on the brain and it will prevent people from sleeping. So that is depression.
Okay.
What about stress?
Mm-hmm.
Especially financial stress in this time, right? Many people have money issues and, money problems and so on and so forth. When they are struggling with money, they are likely to go through the emotional problem called financial stress. And that stress can also prevent people. That's why people can go to bed wanting to sleep and they'll be there reading their ceiling. They are thinking about finance. Someone can be on the bed and be calculating mathematics, That is what we are saying, the stress. What about academic stress among students?
Okay.
When students are going through a lot of stress academically, it will also prevent them from sleeping. Because for them, it's a question of, I have this test to do, I have to do this presentation, there's an impending exam. So you put it together, there's so much stress on them, and that will also prevent them from sleeping. So these are some of the mental conditions or mood disorders that can really impact on people and prevent them from sleeping, including anxiety, of course.
Yeah.
People who have been diagnosed with terminal or chronic illness, and they've been told that, hey, you are going to die, you will not survive this condition, they go to bed with anxiety, with fear, right? That fear that something's going to happen to them, that they are going to die, that they will live long. That form of anxiety can also be one of the reasons why people struggle to fall asleep or stay asleep, right?
Yeah.
What about smartphone addiction, social media addiction? Now, in this recent times, this is especially among students, adolescents, that is what prevents them from sleeping. They get addicted to social media, they get addicted to their smartphones, they are on 12, midnight, 1, they are still online, checking videos, scrolling, liking. That will prevent them from sleeping, of course. And what about, when people take alcohol?
Okay.
Alcohol, excessive intake of alcohol, of course, is known to impact on the brain.
Yeah.
And when the brain is impacted, it's difficult for anybody to have adequate sleep as they should. What about smoking? The more people smoke, it gets difficult for them to be able to also sleep because smoking also impacts on the brain. What about gaining excessive weight?
Wow.
When people gain excessive weight, there's a risk factor for depression, anxiety, stress, and that is why excessive weight gain can also be a risk factor for why people struggle to fall asleep. What about leading a sedentary life? For people who are always sitting at one place, they lack movement, they never really exercise, it also puts them at a high risk of depression, anxiety, stress. And it also, sedentary lifestyle can also prevent them from getting the sleep that they are looking for. What about taking too much caffeine? Caffeinated beverages have been shown to also impact on people's sleeps and therefore prevent them from having the sleep that they want. Growing older, menopause, medical conditions such as diabetes can also be a huge risk factor for insomnia or having a difficulty falling asleep or staying asleep.
Wow. So that really means that there are a lot of, causes of insomnia. Like the list continues as well. But Doc, in our country, Ghana, for instance, we know that insomnia basically affect all age groups, being children, being adolescent, the youth,
Right.
the aged, the whatever. But I know you've been a practitioner for long.
Right.
In your own experience and practicing clinical psychology and attending to, mental health patients, which category of group do insomnia really affect most?
You mean all the people we have?
Yes.
Insomnia much more prevalent among the working class.
The working class.
The working class, the corporate people, There's so much stress that comes with work stress, There's so much issues that happen to them in the work setting. For example, those who do business. So if you do business and then you make a loss, right? When you make a loss, you get depressed, it's going to affect your sleep because when things don't go well as you expected in your business, it's definitely going to affect you. The working class and also the older folks. Older people have a lot of things to worry about compared to younger people. You have to pay your child school fees. You have to make family contributions. You have a chunk of family people depending on you, looking for money from you, right? And they go through a whole lot. There's a funeral you need to attend. There's someone sick in the family you need to help with money. So older people are also at a higher risk of, insomnia. But in this time, younger folks are also at a high risk given their use of the internet and social media and smartphone addiction. Is more prevalent among younger people than older people, right? So the chances of younger people also suffering insomnia is also high because they are addicted to smartphone, internet, social media, and so on and so forth. So that is how prevalent insomnia is in our country, as you mentioned.
Wow, interesting. So, Doc, there is this notion that goes like, they make an assertion that having 8 hours of sleep is good for every individual. Averagely, 8 hours of sleep is good for every individual. Are we looking at the quantity of sleep, or are we looking at the quality of sleep that can make or that can improve a person's mental well-being as far as his sleep condition is concerned?
Well, both quantity and quality of sleep is very much needed.
Okay.
In quantity, we are saying that between 7 to 8 hours for adults, is really good or adequate for them to have such an amount of sleep. By quality, of course, is also very important, but quite often, how do you even measure quality of your sleep? When you wake up, when you sleep and you wake up, how does your body feel like? If you feel good, your body is stronger, you don't feel tired, then it means that the quality of sleep that you had was good. And if you wake up, you are less stressed, you are less depressed. After waking up, you know that you had a good quality sleep, because that is the job of sleep. Sleep is supposed to make our lives better. It's supposed to reduce our stress and so on and so forth. So quality sleep is something we can judge after we are awake, to know how our body is feeling and to look back and say, how was my sleep? How was my night? If you had quality sleep, If you had a sleep where you had dreams where cows and whatever were chasing you, you know that sleep was disrupted in that way, of course,
Oh, yeah. Wow. So, Doc, not to cut you short, but going back to the causes of insomnia.
Right.
Yeah, you said something about stress.
Stress.
Okay. Yes. And you made a reference point to the youthful population where insomnia can really affect them. And I just want to make an emphasis where in this world today, relationship has been an issue.
Right.
Here, there are a lot of breakups.
Right.
There is a whole lot of disparity going on in relationships, especially with broken hearts. I mean, if you've gone through broken heart, I'm sorry.
Yeah.
Yes. So how can such situation, or let me put it in this context, can such situation trigger insomnia for an individual?
You mean the stress that comes with relationships?
Exactly. Relationship
In terms of
failures and
breakups,
yes.
in terms of relationship challenges, in terms of all the things that happen in relationships. People who have gone through divorce, people who have been broken out by a boyfriend or a girlfriend,
Exactly.
people who have been cheated on. Of course, all these things, as you mentioned, will send someone into depression.
Wow.
Right? When people are divorced, when people are given a broken heart, when people are going through relationship challenges,
Wow.
all this will put stress on you. It also put depression on you. And that is why it interrupts the sleep that people are supposed to have. And also, one of the biggest things when it comes to difficulty sleeping or falling asleep is the thoughts that we have about the negative events that happen to us in this life. Someone divorced you, someone gave you a broken heart, you start thinking that you are not worthy, you are not valuable, that is why they left you. If you were good, why they left you, you will never find someone like them or whatever. All this kind of negative thinking will send you into much depression, anxiety, stress, and therefore also disrupt your sleep.
Wow. So, Doc, to follow up on that,
Right.
What is the duration?
Right.
If someone comes to see you, like, Doc, I'm not sleeping. I find it very difficult sleeping, and even always I'm staying awake.
Right.
What's the long duration, or let me say the duration at which an individual could be diagnosed or can come to his conscious state that he or she is suffering from insomnia? Should it be a 6 month, 1 year, 2 years, or even just a month of the person going through an insomnia?
Ranging from, it has to be consistent, of course. It differs for every individual, and quite often you will judge it from how it's impacting on the person, when people are not able to sleep. So pretty much from 1 month to 3 months to 6 months onwards, then we are saying that it could be a very severe type of insomnia that we are dealing with.
Wow.
Individual difference, of course, it will impact on people differently. So, of course, we talk about clinical judgment.
Okay.
And it depends on how the person comes in. Like I saw someone who came in, he said, I've not been able to sleep for 2 days, right? And he can't even close his eyes, and his eyes are just blinking and blinking, telling me he cannot sleep, right? Take your time and go into it, right? Take your time and go into it, and you come to see that, right? What was really behind that guy's sleep was depression, anxiety, stress. He had done some things in life which are now haunting him, which are now making him depressed, and therefore he goes to bed thinking, and that is why he cannot sleep. You get a point I'm making. So it differs for everybody, but between 1 to 3 months, 6 months onwards, we can say that this is a severe insomnia someone is going through, and therefore may need to see a medical professional like a clinical psychologist, like a psychiatrist, and so on and so forth.
Okay. So, Doc, there are certain myths that surrounds insomnia, and then for people to really recover from insomnia, most people resort to taking, sleeping pills just to recover. Yeah. What is your view about that? Is it more of an effective approach?
Well, so sleep medications for the dealing with insomnia, I think that they are a temporary approach to dealing with sleep difficulties. You take it, and what it means is that next time, if you want to be able to sleep, you need to take the medication again.
Oh, okay.
Right? You cannot live a lifetime
So basically, it has been prescribed by.
Of course, it's prescribed whenever necessary. People do those kind of prescriptions.
Okay.
But what I'm saying is that you can't live a lifetime of every day having to take medication before you can sleep.
Okay.
Right? So I say that sleep medications are a temporary approach to dealing with sleep difficulties. And it doesn't really address the root cause of the insomnia or the sleep difficulty the person is experiencing.
Okay.
Quite often the root causes are depression, anxiety, stress. The root cause may be taking excessive alcohol, smoking, suffer from a chronic health condition, menopause, lack of movement, negative thoughts disturbing the person. There are a number of things that actually the root causes of sleep difficulty. For example, financial stress.
Yeah.
And you can't give any medication to treat financial stress per se. So if you say you give medication and then that should be able to deal with the sleep, it goes nowhere, literally. It's just going to temporarily help the person to sleep. But in the long term, the root cause is not addressed. The person will have worsened sleep even than that. So I don't say rely on medications to be able to solve your sleep problems.
Wow. Insomnia is really one of the greatest issues affecting mental health. So, Doc, to every cause, there is an effect.
Right.
An individual going through insomnia, staying awake, having sleepless nights.
Right.
What could be the probable effects that such people could have?
Of course, the effect of insomnia on a person, right?
Yes.
Of course. Sleep, as we all know, we call it sleep medicine, It's one of the best healers of our time, One of the main medicines for the body is sleep. It helps us to heal from many things, depression, anxiety, stress. It helps the body to function well biologically. There are many health conditions that you can avoid, like diabetes, for example, type 2 diabetes, if you are getting adequate sleep. Because if you are not getting the right amount of sleep, people tend to gain weight. Gaining weight is a higher risk factor for type 2 diabetes. Yeah. So the more sleep or the better sleep people get, the lower their risk of developing diabetes. So that is just one way, and sleep does a lot for the body in terms of your mental health, in terms of your physical health, and everything, literally. Because if a body doesn't sleep for a longer time, we are talking about death for that person for sure. So we need sleep to be able to survive. It affects our mental health. If we don't get to depression, anxiety, stress will go on in our life. And we know that when people sleep, get adequate amount of sleep, they're able to avoid the depression, anxiety, stress, avoid some physical conditions like type 2 diabetes, high blood pressure, and so on and so forth. So that is what happens if people don't get the right sleep. They will have all these impacts on their mental health and their physical health.
Wow. If you don't get the right sleep, you would have the wrong impact on your mental health. So, Doc, let's look at the intervention. What solution can individuals going through insomnia sleeping, sleepless night, and all those realms, develop? Or what kind of coping strategies can an individual adopt
Right.
that could help them mitigate their problem with their sleeplessness? Is there any intervention that you could share with us?
Loads of intervention.
Yes.
Loads of intervention. But let me make the point that we can't do intervention in a video for anybody. So we can't do intervention here. We'll talk about tips that people can personally ensure to help them have a better sleep. Tips, right?
Again,
that is no intervention, because when you go to the clinic, you see a clinical psychologist, psychiatrist. Together, these two groups of people can really help you and deal with insomnia. And that is where the intervention will be done.
Okay.
But what we want to share with them here is some tips that can help prevent insomnia, that can help overcome it or reduce it to some extent for a person. Right. So the tips, right? 1, someone wants to deal with insomnia, prevent insomnia, or reduce insomnia in their lives. If they are already experiencing insomnia, they have to cut down on the alcohol intake. Excessive alcohol intake has to be cut down. And if you want better solution, I say throw the alcohol away.
Okay.
And then your sleep has to be better, of course. Of course, many people who take alcohol will not agree with me, but scientifically proven, less alcohol you take, the better your sleep.
Okay.
Right?
Wow.
That is just one tip.
Wow.
Now, we talk about cigarette smoking or smoking of any substances, right? Do away with smoking, your sleep has to be better, right?
Okay.
What about exercising? Of course, exercising has been shown to release chemicals in the body that helps people to have better sleep. So adding some jogging, some walking, especially in the evening, can definitely boost sleep, right? How about dealing with depression, anxiety, stress? Of course, you can't deal with it entirely by yourself, but some tips. Of course, exercising can help you deal with depression, anxiety, stress, right? Having a balance that can also help you deal with depression, anxiety, stress, right?
Yeah.
Changing the negative thoughts in your life can also prevent depression, anxiety, stress. Making sure that you control your weight, body weight, of all higher body weight or excessive weight gain can also be a risk factor for depression, anxiety, stress, right? What about stopping the caffeinated beverages that we take, right? What about avoiding a sedentary lifestyle, making sure that we are living an active lifestyle? If you're at work, can you walk a bit, right? Can you stop yourself from sitting down for a longer time, right? There's a lot that can be done, and these are some of them that I've shared.
Wow. So that means that insomnia doesn't exist in a vacuum. There is a whole lot of cause that really affects or brings about insomnia in a person's life.
Yes.
So, Doc, since we are concluding with you, can you give us one of your best advice out there to people who are watching us here on your YouTube channel? What is the best advice you can give to them as far as insomnia is of concern?
The best advice is that we all have our life in our own hands. It's also been shown that if you want a longer life, then you should have a better sleep. Your sleep quality should be better for you. So sleep is not something we can joke with at all if we want a longer life, right? So meaning that all the things that we've mentioned, from stopping alcohol intake, from stopping the smoking, from dealing with depression, anxiety, stress, from making sure that we are exercising regularly or living an active lifestyle, preventing a sedentary life, stopping caffeinated beverages, stop eating junk foods, which can lead to excessive weight gain, and for that matter, lead to depression, anxiety, stress, which can also impact your sleep. Stop the social media, at night, smartphone addiction at night, social media, internet browsing at night. Therefore, we can have a better sleep and therefore have a longer life.
Wow. Thank you so much, viewers, for joining us on this educative, informative, as well as a more of, a deep understanding of what insomnia is all about. And we expect to see you in our next YouTube episode section with the same Dr. Daniel Miezah. Thank you for joining us. See you.